So we created a
Just like you get to know your patients and the athletes.
because he loses it all the time.
Today I have a very special friend and guest, but this is the Neuro Collective podcast, all things brain, brain health, and how we start to bring optimization to our brain function. So today I have a special friend, as I said, Dr. Spencer Barron. Welcome to the podcast.
Welcome. I feel very welcome. I look forward to this today.
Well, I did send you coffee so that even though we're in different locations, that'll welcome you into. No, I didn't do that, actually. I didn't do that. But anyway, let's just jump right in because you and I had previously talked a little bit about some of the ideas we wanted to bring forth here to encourage people, to give them insight. I love the thought to pull back the curtain on some of the things we've experienced that, other people may never have. You're more than 35 years in health. I'm just behind that. But before you jump into the healthcare, I'd like for you to just give your own personal upbringing a little bit, just kind of where did you grow up? And what was it like for you growing up?
Actually, thank you for asking. My parents, pretty much, I was born in New York, lived in New Jersey, 11 years old, moved to Florida, lived here most of my life. My dad was from New York and my mom was born in Europe and Spain. So there was like a holistic mentality to some degree, especially from my mom's side. I did not know that my dad went to a chiropractor. I remember vividly, we were in New Jersey. He injured his low back so bad that he was laying on the bed and he couldn't. And my dad was like a strong, tall, lean guy and always go to the gym or run or something. And it wasn't until I got into chiropractic college that he told me that he's always gone to a chiropractor. And I go, Dad, that day that you were in, I might have been like 7 years old. He goes, yeah, I went to the chiropractor in the back door because that was not such a thing back then. And so when I became a chiropractor, he was quite overjoyed. And he was one of my better patients as well
Wow,
as my mom.
what a great story. You're
Yeah.
reminding me that my dad had a severe car accident, head-on collision that almost took his life in the early mid 70s. And a guy used to come to our house after that, after he did survive ICU for 9 days. And a guy would come to our house wearing a cowboy hat and boots with a thing that opened up, which was a portable table. And he would work on my dad at the house. Now, this is maybe, a year, 6 months, a year later. And that guy was a chiropractor. I didn't know what he was doing. Isn't that something? We both had an interesting experience with our fathers
Fascinating.
through that. Now, your father, he passed away earlier.
Yeah. Oh my gosh, 2009 from pancreatic cancer.
Mm.
And sadly, the only two people that I've ever had to diagnose with cancer were my dad and my stepdad.
Oh,
And they thought they were just having low back pain and they incidentally mentioned some things. So I harbor a lot of anguish from that, but
wow.
part of
That's,
the process.
yeah, I mean, people don't realize, perhaps, why would they, that even people that would be in some type of physical medicine, which is what it really is, like physical medicine approaches, chiropractic, some physical therapies, orthopedics, we deal with human beings that go through crises and pass away, and we become very close to them, right? And so it really, especially that couldn't be closer than your parents.
Yeah.
Yeah, that's a
Well,
difficult suffering.
chiropractic is a unique profession because we who are conscientious chiropractors develop relationships with patients. Dr. Mike, I remember when you took care of my practice when I went away
Yeah.
and a patient loved you. To this day, you still ask about it. That was like, what, 30 years ago?
Yeah, that was so interesting. I was brand new in practice, and Dr. Barron was going to travel, and he trusted me enough. We had become colleagues and friends to come into his practice and take care of his patients for a week. Now, that was a really wonderful experience. I appreciate that even to this day, actually, because it gave me a sense of confidence in someone had confidence in me, another professional, which really was it built me up. The very first patient in the morning. Now, Dr. Barron's office was quite a ways from my office in Miami, and Miami has a lot of traffic. So there was no way for me to get back home after this situation. As soon as I bent down for the first patient, I ripped my pants. And not like a small rip, ladies and gentlemen, like, from stem to stern. Is that what they say? I couldn't believe it. But his wonderful office manager gave me a sweater and I tied it around my waist And I worked the rest of the day, and all things were great. So what a funny
I
situation.
forgot
Funny
about that.
situation.
That's
So
right.
how was your evolution into healthcare? So now we know where you kind of came from. How'd you get into healthcare?
Interesting that at the time that I was making a decision after high school, we're talking about, in the mid 80s, I graduated from high school in 79, actually. And then, I became a gym rat.
Mm,
And that has a lot of meaning to it because of the fact that I was deciding on what I wanted to do. Law or psychology were my choices. And I realized later on, shortly after making that decision, I go, law back then was very combative, very,
mm,
very much there's a winner and there's a loser. So forget that. Psychology back then was somebody laying on the recliner, and you would typically or stereotypically go, "So, how did it all start?"
yeah.
And they would go from child. And I don't have narcolepsy, but I feel like I do, and I would definitely have passed out many times. So I go, well, that's not good. And I originally thought about being a medical doctor, but back then, again, that was very antiseptic. All I really knew was it was, again, stereotypically like a conveyor belt medicine, prescription, prescription, prescription. And that didn't mean anything. It prompted me to ask myself some very important questions. And that was, what can I do for the rest of my life that would be fun, invigorating, and just, like a payoff emotionally
Mm,
as well as monetarily? And I thought about it, and I'm telling you, the moment I made that decision of I wanted to do something that was health oriented, something that was more natural, and that you developed relationships with patients and be your own boss and make good money. Had no idea. I remember a guy, Gary. Gary came up to me in the gym out of nowhere, and he goes like this: "Hey, Spence, you know what? You would be a good chiropractor."
hmm,
And I looked at him and I go, Cairo, what? What is that? And I started investigating this chiropractic thing. And I said, geez, this so resonates for me. This is like
mm,
every entity, every part of it, it resonates for me. So I went ahead and I applied and ended up going to a school in Houston, Texas. And it'd been around for about 80 years. And little did I know that when I graduated, the curriculum was so rigorous that when I came back to South Florida, friends would call me, chiropractors would refer to me as a medipractor. Oh, you're just like a medical doctor disguised as a chiropractor, because our education was wonderfully comprehensive, and I'm grateful to it now.
yes. Yeah. That's great. I mean, just out of a little conversation, it almost put like a seed. I think of that inception, right? Plant a thought. But this is how powerful someone's just gentle speaking can be to us, or
Yes.
us to a patient, that can help them kind of take hold of something beneficial for their lives. I mean, and you've really worked with, I thought about this yesterday, tens of thousands of people, tens of thousands, right, of people you and I have both been able to lay our hands on, hug, help, hold. That's a lot of people we've been able to touch their lives in some way. Hopefully more, the majority for the better, right? The majority for the better.
You bring up an important point because we've been practicing for so long that in my 8th year in practice, I thought, geez, how many spines have I actually treated? Well, extremities too, and I actually did a rough calculation in my 8th year. By my 8th year in practice, I treated almost 100,000 spines.
Wow.
Yeah. I mean, now, mind you, some of them are duplicates and things, obviously, because we see patients
No,
like
hundreds of thousands.
rehabilitatively. And I've been practicing 38, they're going on 39 years. So we're talking truly hundreds and thousands, maybe a million times I've adjusted
Adjusted.
different patients. And with that said, they come from, little kids to,
Mhm.
grown up geriatric adults, and everything in between, and, weekend warriors and top pros and things like that. And not once, Dr. Mike, and I want to make this very clear, not once have I've ever had a hint of a lawsuit
Mm.
or or a disgruntled patient, because as you well know, it has everything to do with communication skills and developing, a sincerity and concern for our patients.
Yes, yeah, that's well said. Concern and communication and keeping that open. I know that recently was talked about when we were on a panel together speaking to other colleagues a couple of years ago about how communication is the number one way to mitigate problems for people that might arise later, is being able to stay in communication and not doing what I call fast medicine, like you were talking about earlier. It's not one to one to one to one to one. It's like, let's just take a little time, whatever that time may be, that the person really senses that you're present with them. And I know that you have a great presence with people. I've experienced that personally, and I've seen you interacting with hundreds and hundreds of colleagues and patients. So I appreciate your care for people. Let's move into your professional career in working with top athletes, as you mentioned. Now, you were the physician for a number of South Florida's professional teams. So why don't you share that with us?
I actually started out, like I said, I wanted to do something that involved, activity, exercise, healthy people for the most part. Sports was an interest to me, but I never in a million years imagined that I would become the chiropractor for the Miami Dolphins back starting in 1996. And and then did that for 19 years. In 1997, I believe it was, I was asked to be the chiropractor for the Florida Marlins back then. Now they're called the Miami Marlins, and I had no idea I was going to get caught up in something called a World Series. That was interesting. At the same time, the following year, I was called by the head athletic trainer for the Florida Panthers to might as well become the chiropractor for the Florida Panthers, and did that for about a year. It was incredibly fun. The learning experiences that I gleaned from how fast athletes can heal, or better yet, how fast the human body can heal from injury
Mm,
and illness. Why? And I tell you, Dr. Mike, I've said this over the years. Athletes at that level get the best health care in the world, indisputably, no question about it. Why? Because it's based on time. The cheapest guy in the Miami Dolphins scrub, let's say, or a practice squad guy, he would get anywhere from $12,000 to $17,000 a week because they were paid on that 17-week basis unless they were in the playoffs. So it was in everyone's best interest to get them better fast. And
mm,
so they would employ all sorts of things that would help get
wow.
that player. Because the days of injecting a knee to, get rid of the pain and go back out and play, those were long over. And so a lot of the natural health care became very, very important. And these players became very conscientious, and their agents were making sure that we were taking care of them in the way we do best.
Wow, that's remarkable. You mentioned something that you and I have in common, which I didn't realize this, is that was it 1997, the World Series for the Florida Marlins? Yeah, so you're the chiropractor for them, and I was in the stands for Game 7.
You never told me that.
You know what? I talked about this yesterday with a patient. Actually, her son plays baseball and she was talking about the Marlins. And I said, I've actually been to a World Series game. Not sure exactly what that is, but disregard it. Nuclear alert here. But how interesting that I was in that very game. Yeah. More
I
interesting that you were taking care of them.
Yeah, it's funny because you'll understand that I was uh, I was asked during that time, after I took care of after I was with them in the locker room, adjusting all these rock star Major League Baseball guys. It was They asked me, they go, well, are you leaving now? It was about 7 o'clock. It was, starting game time. And I go, yeah. And they go, well, you could stay, you could hang out in the dugout or something. And I go, oh, no, no, no. I'm going to go home and I'll watch with my wife. And so I left, and I realized as I'm walking out, or well, as I'm leaving, hundreds and hundreds of people are coming in, cars everywhere. I actually panicked because I couldn't find an exit. There was no way to get out.
Oh, wow.
Yeah. So And then at that moment, I realized, okay, there's an exit. There's one exit I see off to the side. And the fact that then I started to realize, I go, wow, if any one of these people knew I'd had my hands on their superstars, I would probably be molested at that moment.
Wow. Well, incredible. See, those are those backstories that are so interesting. I'm going to jump ahead for a moment because there's a really remarkable story. Because, of course, Neuro Collective podcast, we need to get to know you, just like you get to know your patients and the athletes and moms and dads and kids. But there's a particular patient that had a very unfortunate and remarkable situation. And then I'd like you just to kind of share that because once I heard you share this amongst our colleagues, it really impacted me as someone who works and is concerned about brain health. And that is Junior Seau, who played for the Chargers and the Miami Dolphins and was a standout player, all pro for many years. And he ended his career, I believe, with the Dolphins. And then your experience with that in relation to the brain and how the brain goes through changes, especially when we have impacts. If you could share that, I think that would be very important to kind of move to this next segment.
Sure. If there's one thing that I have some remorse about is my lack of knowledge and experience and identification of things before they happen in a situation like Junior Seau. Junior Seau was a incredible veteran of football. He actually played the Chargers from 1999 to 2002, and then he was with the Dolphins from 2003 to 2005. He ended with the Patriots. But I will say that when he was with the Miami Dolphins, his presence was so big, and he's just a gregarious, bigger than life, figure. His personality, I could see where he had this leadership quality because he loved everybody, and he referred to everybody as, "Hey, buddy." He would walk in, "Hey, buddy, hey, buddy." He would come in to the point where it was so contagious that we would go, "Hey, buddy," to everybody as well. So, and that's an important point in just a moment. So he would come in and he would get adjusted and he would walk out and, thank me and just be real personable guy. Big guy, linebacker, right? And so I noticed that he would leave his phone under the table very often. And I would run out and go, "Hey, Junior, Junior, Junior." And I would give him his phone. One day, again, he left his phone and I quickly, he had walked out and I go, "Oh, for God's sakes, he left it again." So I picked it up and I go, "Hey, Junior left his phone again." Yeah, I catch him. He just went. And I realized, I go, Junior has a cheap old flip phone. A guy who's made millions and millions of dollars in his career. What's he doing with a cheap old flip phone?
Right.
And I asked the athletic trainer, I go, "Did you see his phone? It's like garbage." He goes, "Yeah, because he loses it all the time." Fast forward, it was 2012, I believe it was, that they found him. His girlfriend at the time walked into the bedroom and found him dead from a gunshot wound to the chest. It was deliberate because he wanted to make sure his brain was saved for science and to determine if what we now know, if there were tau proteins from so many concussions and hits, especially with a guy who's a linebacker that many years in the profession and that good. And lo and behold, truth be told, that's what it was. Now, my regret and remorse is what you and I know today after taking that mild traumatic brain injury course, and you went on to fly high with all the rest of that neurology. But we learned that those were signs and symptoms. The reason why he would call everyone buddy is because he never remembered anybody's name.
Oh, interesting.
The reason why he left his phone is because he just was experiencing problems of recalling and remembering things that were simple. And so if I would have known back then what I know today, maybe he would still be around.
Maybe, yeah. Yeah, it's true. Yeah, and we see that even today, and with the current Dolphin quarterback, so many concussions in the past few seasons. Even in one of them, which is clearly to most people, even lay people, wow, that looks like he might have had a concussion. They say no, he had a back injury. He goes back in the game, receives another subsequent blow to the head, and then so it's really, I mean, it's epidemic, it's everywhere, and you do the best you can, right? But yeah, that's a very, very touching story for me. I know for you because you lived it, and I appreciate you sharing that with us. How do you think now about what you do and the impact on the brain? I think prior to my and your going together actually into the fellowship in brain injury rehab, when we attended that so many times together, those courses. I wasn't thinking as much about the brain with what I was doing. Now it's completely different. So how has it changed your thinking process about healthcare in terms of the brain and what you do as a chiropractor and working with clients? How has it altered that?
Well, probably one of the most profound ways is to be able to, again, communicate what we do and on a daily basis. Because people ask, what is that popping and cracking sound? And I really believe that we have to be very versatile as physicians in our ability to explain what we do, the elevator speech and so on. And your versatility is very contingent on how you will get follow through and inspire a patient or a potential patient or just an individual that is maybe downplaying the benefits of chiropractic. So often said, like, how versatile are you in your explanation? And when I was doing career days for high schools and junior high schools and stuff like that, and even elementary schools, imagine trying to explain what a chiropractor does to, a third grader. So we would be obnoxious, because I can be that way, and really get the energy up. And I realized that these kids they need a mentor. They need a superhero. They need, and so Chiro Man was born. So we created a image of Chiro Man. So now, what can I say to them instead of going, well, this is the spine and we have something called subluxations. And when we do a adjustment with our hands, it affects this tribonucleation effect. And so, are you kidding? I would have lost them a long time ago. So what I realized after listening to the song, the Candyman can't, I decided to explain simply this, something that they could go home and tell their parents. Spine in line makes you feel fine. Done. End of story. Then I went and I realized when I was working with some of these athletes, I go, how can I got to make this like bite-sized perspective. So I would tell them, spine in line makes you feel fine. That's all.
Same story.
Yeah. So I realized how cool that was, because when a seasoned player was talking to a rookie at Miami Dolphins, and there was a line waiting for me to treat, the rookie would go, "Hey, what's that guy doing?" And he goes, "Spine in line makes you feel fine."
I love it.
And the flip side from what we learned, and this is probably the most important aspect of it, is what happens, because when I was adjusting before a game, right before a game, was when I was traveling with the team, guys would line up and it was one after the other, adjustment after an adjustment, and it was like a machine. And so I would see the medical doctors off to the side going, so what's that cracking sound? And at that point, I had to give an explanation that spoke to their nomenclature. It spoke to them and resonated for them. So I would often say, listen, when I adjust the spine, that cracking sound, that audible is really what happens. Is it may be gases being released from the joint, it may be a tendon twanging over the joint or something. But the most important part is we call it high velocity, low amplitude adjustment, HVLA.
HVLA.
And it's recognized on something called a Maitland scale, which is really something identified by physical therapists. On a Maitland scale, graduated from 1 to 5. That 1 is just kind of mobilizing the joint. A 5 is what we do, HVLA, and nobody else can do it as good as we do, because that's all we do very well, period. Right. Now, when the muscles stretch and the joints and then that synovium, they mobilize under that inertial force, what happens is the fast stretch affects something called receptor. There's receptors in the muscle and in the synovium of the joint. And so what happens is there's something called, and it's really important, Pacinian on-off corpuscles. These are low threshold, rapidly adapting mechanoreceptors that respond to shutting off nociceptive fiber, 3,4 pain fibers.
Right.
And now what you're experiencing one of 3 effects. You're experiencing a pain reduction in the periphery where you adjust. Okay, that's 1. 2, you get from there, you'll get a burst in activity that'll fire up the dorsal columns into the cerebellum. And then into the cerebellum, they can take two areas. The axons will go to the fastigial nuclei and take 2 routes from there. Crossing axons go from the fastigium and pass through into the vestibular nuclei. So that's stage 2. Now you got an effect on balance and proprioception, vestibular nuclei. Then they go through the reticular formation of the pons and medulla, and in the pons and medulla, the mesencephalic reticular formation, and something really important to us all. It's called the periaqueductal brain, which is called the PAG, P-A-G. And that area is a very rich supply of endorphins that cascades systemically into the body. And the periaqueductal gray matter plays a role in descending modulation of pain and defensive behavior. And that is why there's a line of athletes waiting to get adjusted.
That's a good encapsulation for our lay people. Dr. Barron just gave us the neurologic explanation, or tracks, if you will, the direction of why a physical adjustment, movement of a joint can affect the neurological system of the human being, and actually does every time, and has a consequence in a person's brain. Equates to there's science behind why your brain goes through wonderful changes when we get adjusted. When we get, some people will call it a manipulation, but I like the high velocity, low amplitude. This is the correct terminology. So this is good. I mean, we dig into the science here. We go about maybe 2 to 3 layers deep. I think you did that marvelously, exquisite. And yeah, it's good for people to hear this language and replay that a few times for yourself if you're listening, because that is the way it works. You just keep hearing it and you're like, I'm starting to get this. And then maybe they just realize that, yes, this does affect the entire neuraxis, the human being's brain. So beautifully said, wonderfully done. Tell us a story as we're kind of wrapping up here of one of these really remarkable situations you experienced with one of your athletes or with one of your patients that you feel like, wow, this is one of those peaks. And I'm sure there's many peaks, many peaks after almost 40 years. So give us one really beautiful one that you enjoyed.
Well, there's a recent one, because I talked about all the old stuff, but there is a most recent one because a lot of pro guys still come in and get taken care of, or they're referred in by others, you know. And so just recently, last year, there was and you can look him up. I don't know if I could say his name, but he has thrown the fastest pitch in Major League Baseball, period, unequivocally. And what was it, like 105.5 miles per hour or something like that. He came in after a season of pain. This was last year. He had pain right here. It's documented. Everybody knows about it. The athletic trainers were treating him the whole time. We were questioning him. I have a wonderful associate. I love this guy. He worked with the New York Jets as an athletic trainer, and now I have him as a chiropractor. So we're talking about this pitcher. And I go, you know what? Let's examine. Look, we could treat this, the forearm, which is his pitching arm. He was a lefty. But I suggest we look at where his power really comes from, because I think this is the secondary or even maybe the tertiary complaint. And it's coming from below. So your understanding of biomechanics and neurology plays a huge role in being a detective, like your book, right?
That's right.
And so being a detective and trying to solve the mystery is everything. So I said to my associate, I said, check his big toe. What? Check his big toe, check for range of motion, ask him if he has pain, and check the strength of his big toe. Why? Because a pitcher pushes off with his big toe on the mound and that foot. Lo and behold, we asked him. He speaks broken English, but we asked him in Spanish, "Tu tengo dolor aquí," or "duele aquí," and he go, oh, yeah. So he has pain in the toe, and he has limited range of motion because of so much scar tissue after 13 years of throwing a ball that fast, right? And so I said, well, what else? I go, you know what? Ask him about his knee on the same leg, because my brilliant associate pulled up video the next day of him pitching. It was slow motion, beautifully done. And his leg splays out to one side. I go, God almighty, ask him about his knee. And lo and behold, he has a knee pain or discomfort.
Right.
I said, I'll tell you what, focus on that, period. Focus on that. And you can treat this a little bit, but go ahead, focus on that and adjust him. So he was a free agent that last year or the year before. He was a free agent, and Now, mind you, all the injury is documented here. They did an MRI and he was told he had osteoarthritis and stuff like that. I go, osteoarthritis for a forearm injury? Anyway, so how much of that is normal, right? He gets looked at by another team that they're looking to pick him up for last year. And they do an MRI. They don't find anything. They say, you're great, man. We're going to give you a $1.2 million contract for the year. And he got it.
Wow.
I said to my associate, man, he needs to give you a couple percentages of that.
Wow, that's remarkable. I love how you're following, as you said, as a detective, following the chain, the biomechanical chain in this case, but how we kind of pursue, and you've pursued things through people, not doing fast medicine, but taking your time, considering the brain, considering the neurology, considering the soft tissue, considering the mechanics, and putting that all together in order to have the best outcome. Optimization, right? To optimize and get them not only out of pain, but get them to that next level if perhaps that's possible. Yeah, that's definitely a specialty of yours. You infuse them with, hope. You provide them a high quality care, and then you share with them, educate them, which also builds that. The knowledge level is important that you share with people on wherever they are, bringing them up, because that helps them to have more certainty, more understanding, right? I always say that you could have the most beautiful car. You could have this beautiful, if someone like Tesla, brand new, but if you don't know how to operate it, it's really of no value. So, the knowledge about, everything that you uncover for people is just as valuable, I feel. And that's where really kind of the podcast. And I know you're involved with the podcast, and I've been able to be a guest on yours, the Cracking Backs podcast, right? With Dr. Terry. And so, yeah, a little plug to that. Look that up. Now, I know yours is available on Spotify and Apple Podcasts, Cracking Backs podcast. Check that out. And so you've been with myself and Dr. Barron for a little view, pulling back the curtain, if you will, into chiropractic, brain health, some interesting situations, some sad but yet takeaway lessons from Junior's life and Dr. Barron's life. And so this has been fun, always enjoyable for us to be together. It's just one of those things where, we're brothers in a way from many years. So I always appreciate you.
Always. You bet.
Good to be with you again today. And we'll talk more soon, and we'll plan another time.
You
So
bet.
until
Thanks.
next time, enjoy the podcast, take care of your brain, and think about getting adjusted if you never have. Find the right chiropractor, chiropractic physician. They'll help you out. Take
Right
care.
on.